Healthy people should strive to maintain a fasting glucose level between 70 and 85 milligrams per deciliter, and a 2-hour post-meal glucose level of no more than 40 milligrams per deciliter above the fasting levels, or a maximum of 125 milligrams per deciliter. Adjustment of the dietary habit can help to stabilize the glucose levels and achieve these goals for many people. One dietary strategy for avoiding a rapid spike in blood sugar after a meal is to increase the intake of dietary fiber. This slows the rate of carbohydrate absorption. For example, a study on 63 patients with type 1 diabetes assessed the effects of 24 weeks of a high or low fiber diet. It compared 15 grams of fiber daily to 39 grams, and those who had the 39 grams exhibited half as many episodes of hypoglycemia. The increased fiber intake in the study was accomplished by eating more fruits and vegetables. A more direct way to reduce the glycemic impact of the diet is to consume fewer carbohydrates. This was tested in a group of subjects with severe reactive hypoglycemia who'd recently undergone gastric bypass surgery for weight loss. In the study, the high carbohydrate meal contained 79% carbohydrates, 11% fat and 10% protein, and the low carbohydrate meal contained 2% carbohydrates, 74% fat and 24% protein. Of the 12 participants, 83% showed improvement in their symptoms, and of these, 25% had complete resolution of their symptoms. The findings suggest a low carbohydrate diet attenuates the pathological glycemic excursion in this population. Typical dietary suggestions for reactive hypoglycemia include avoiding refined carbohydrates like white rice and white flour, eating several small meals and snacks throughout the day, avoiding excess alcohol while fasting, eating foods with low glycemic index. Supplementation of the diet with fiber, such as fructooligosaccharides, can help to stabilize the post-meal glucose by prolonging the carbohydrate absorption. This can be beneficial for people who are prone to reactive hypoglycemia. Fructooligosaccharides are fermentable prebiotic fibers, and they're found in plant foods like onions, garlic, chicory, asparagus, artichoke, and bananas. A study found supplementation with 20 grams of fructooligosaccharides per day for 2 weeks in people who had reactive hypoglycemia resulted in a significant improved blood sugar and fewer episodes of the hypoglycemia. Chromium is an essential trace mineral, and it plays a significant role in sugar metabolism. Chromium supplementation helps to control the sugar levels in type 2 diabetes, and it improves metabolism of carbohydrates. A small double-blind crossover trial assessed the effects of chromium on 8 women with symptoms of reactive hypoglycemia. The supplemental chromium at a daily dose of 200 micrograms for 3 months led to improvements in both blood sugar metabolism parameters and hypoglycemic symptoms such as sweating, trembling, and blurred vision. Green coffee bean extract is an antioxidant-rich mixture from unroasted coffee beans. It can temper the post-meal spikes in glucose. Chlorogenic acid is a compound derived from the green coffee extract, and this has been shown to reduce the glucose absorption in healthy volunteers. One compelling study showed that people not taking the green coffee extract had glucose levels of 130 milligrams per deciliter 1 hour after sugar ingestion. In the same study, the glucose level of the subjects who took 400 milligrams of green coffee extract dropped to 93 milligrams per deciliter after the sugar ingestion. Chlorogenic acid can reduce post-prandial hyperglycemia both by shutting down the excess liver glucose production and also by stimulating the glucose uptake in the skeletal muscle. Another means by which the chlorogenic acid acts to suppress the post-meal glucose is by inhibiting alpha-glucosidase. This intestinal enzyme breaks apart complex sugars and it enhances their absorption into the blood. Slowing the absorption of the common sugars, including sucrose, limits the after-meal glucose spikes. White kidney bean extract is a powerful blocker of the enzyme alpha amylase, and this is secreted by the pancreas. Alpha amylase breaks down long-chain complex starch molecules into simple sugars and short-chain oligosaccharides for absorption in the small intestine. By blocking alpha amylase, it inhibits the metabolism of starch, and it slows the rate at which the sugars are then absorbed. In one double-blind, placebo-controlled study of obese but otherwise healthy adults, 1 month of supplementation with Ervingia gabonensis produced a 5% body weight loss in the supplemented patients, compared to only a 1% loss in the control group. These individuals also saw a significant improvement in their lipid profiles. Additional studies confirmed these findings, demonstrating significant reductions in body fat, waist circumference, blood sugar levels, and markers of fat tissue regulation. The white kidney bean extract has an enormous potential for preventing the blood sugar and insulin spikes that are associated with many chronic health disorders. Slowing the starch digestion prolongs the amount of time that it takes for the stomach to empty its contents, and this reduces the amount of carbohydrate calories released at any one time into the intestine. White bean extract operate along numerous overlapping pathways in multiple related physiological systems. Lab research shows supplementation with the white bean extract promotes weight loss in obese animals, with drastic reduction in fat accumulation, without the loss of muscle mass. Plasma insulin levels also dropped substantially following a high carbohydrate meal, including the white bean extract in preclinical studies, reflecting a much more gradual rise in the blood sugar levels. Extracts from kelp and bladderwrack have been demonstrated to inhibit the activity of the digestive enzyme alpha amylase and alpha glucosidase. Inhibition of these enzymes interferes with the digestion of dietary starches, and it might reduce or slow the absorption of high glycemic carbohydrates. Sucrose, or table sugar, is composed of 2 simple sugar molecules, glucose and fructose. It's poorly absorbed in the intestine in this form. In order to be utilized, it first needs to be broken down by the digestive enzyme sucrase. By blocking the enzymatic action of the sucrase enzyme, it reduces the uptake of the sucrose. And researchers have identified a potent sucrase inhibitor called L-arabinose. The L-arabinose is an indigestible plant compound. It can't be absorbed into the blood, so instead it remains in the digestive tract and it's eventually excreted. By blocking the metabolism of sucrose, the L-arabinose inhibits the spike in blood sugar and the fat synthesis that would otherwise follow a sugar-rich meal. For more on herbs, supplements, and natural treatment plans, check out my website.